Let us now go to visual diagnosis of the skin. The topic is edema of limbs. Edema of limbs due to spleen-yang deficiency will have a pitting edema of the limbs and abdomen. There will be cold limbs, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, feeling cold, with a tongue that is pale and wet and a pulse that is deep and weak. The acupuncture points to be used are Ren 12, stomach 36, spleen 6, and bladder 20, and moxa can be used. Edema that is due to kidney yang deficiency will have pitting edema of ankles and legs, weak knees, lower back ache, cold knees, feeling cold, bright white complexion, tiredness, lassitude, abundant clear urination, impotence, and decreased libido. The tongue will be pale and wet, and the pulse will be deep and weak. The acupuncture points to be used are kidney 3, Ren 4, bladder 23, kidney 7, and Du 4, also using moxa. Edema that is due to dampness will have swelling of legs and ankles. There will be aches, swelling, redness and heat of the joints, hot limbs, a sticky yellow tongue coating with a pulse that is slippery and rapid. Other symptoms and signs will depend on the organs involved. The acupuncture points to be used are Ren 12, Ren 9, spleen 9, Ren 5, and bladder 22. Edema that is due to chi stagnation will have a non-pitting edema of the limbs. There will be a feeling of distension of the limbs, and the skin springs back on pressing the swollen area. The acupuncture points to be used for this is gallbladder 34 and liver 3. For edema due to lung qi deficiency, there will be pitting edema of hands and face, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating, dislike of speaking, bright white complexion, propensity to catching colds, tiredness, dislike of cold, and the tongue will be pale and the pulse will be empty. If it is due to cold dampness, there will be swelling of legs and ankles, feeling of heaviness of the limbs, cold limbs, ache in the joints, feeling cold, with a tongue that has a sticky white coating and a pulse that is slippery and slow. Edema that is due to qi deficiency and blood stasis will have edema of the limbs, cold hands and feet, numbness of the limbs, muscular weakness, purple color of hands and or feet, tiredness, poor appetite, loose stools, weak voice, and the tongue will be bluish purple and the pulse will be choppy. When there is wind water invading the lungs, there will be sudden swelling of the eyes, face, and hands that gradually spreads to the whole body. There will be bright, shiny complexion, scanty and pale urination, aversion to wind, fever, cough, slight breathlessness, a sticky white tongue coating, and a pulse that is floating slippery. This is an acute type of edema, and this pattern is a type of external wind cold. Thank you so much for your attention.